Hawaii Matters. My name's Kathy with a K. I'm here with Tati Guzman of HMSA here in the islands. For those of a sweet age, Medicare, Medicaid, you're going to want to know about all the information. Kind of reassure you that if you don't have all the information, we have the means to get you situated. So, Tati, welcome. To start off with a little bit about yourself.
Aloha, my name is Tati Guzman. I've been with HMSA about 15 years, always with the Medicare line of business. I know it's a very complicated, complex line of business, and I really enjoy being able to go out and speak to people about Medicare, kind of simplify it, demystify it, make sure that people understand how it works, what it is, the parts, and also what they need to do and the choices that they have when it comes to Medicare.
When you first joined HMSA, was that your dream to be working in the division you're at right now?
No, it really wasn't. I was in project management at the very beginning. And then as I got into the Medicare line of business, I discovered, and I always kind of knew, that I have a soft spot for kupuna, for the elderly. So it's kind of my sweet spot in this kind of position that I have. I'm able to actually go into the community and speak one-on-one, face-to-face with our seniors and really help make them understand about Medicare and the choices that they have.
Tati, when you are talking about the kupuna, have you had to sit down with any friends, neighbors, or relatives when they asked you, it's just like, can you help me out with this?
Almost always. Pretty much everybody in my family that's around 65 years old has come to me. So yes, I answer that question a lot, or even when I'm out shopping and people find out, oh, you work at HMSA? What do you do, Medicare? Oh, can I ask you this? So it happens all the time.
We're talking with Tati Guzman of HMSA. We're talking about Medicare and Medicaid. And are those two words interchangeable? Are they different programs?
No, they're actually completely different. So that's one of the most confusing things about Medicare and Medicaid. If people think they're close to each other, they're actually very different.
Okay.
So Medicare is, generally speaking, for people that are 65 or older, or as I like to say, because I'm close to that age myself, 65 or better. 65 or better in certain chronic conditions. Medicaid, even though it's a federal health insurance, it's administered by the state, and it is for people that meet a certain income requirement or are disabled. So very different. So age really doesn't have as much to do with Medicaid as it does with Medicare.
And we are talking about Medicare on this Hawaii Matters. I'm your host, Kathy with a K, again with HMSA's Tati Guzman. Okay, so Medicare, there are different parts. Now that we know the differentiation, what are the parts? And keep it simple. I know you keep it simple. Part A and Part B.
Yeah. So there's 4 parts of Medicare, A, B, C, and D. And actually the reason why there are parts to Medicare is because each of the parts cover a different type of benefit, have different costs, and were passed by legislation at different points in time. Chronologically. So every time they came up with a new coverage, the federal government, they named it a new letter. So hopefully we're done with the letters.
Yeah.
We have Part A, B, C, and D. So let me cover each of those very simply put. Part A is hospital insurance. So that's really anything that's inpatient. 1 night or more in a facility would be covered under Part A, including hospice, skilled nursing facility, inpatient mental health, even home health care covered by Part A. So that's Part A, hospital. Part B is medical. So that's anything outpatient, covers a lot. So we're talking doctors, specialists. We're talking about vaccines, diagnostic testing and x-rays, durable medical equipment like canes, walkers, wheelchairs. That's covered by Part B. And when you hear the term original Medicare, you're only talking about Part A and B. Part A and B, and you enroll through Social Security. Part C and D, you enroll through a private insurance company. So I like to start with D. So that's the easy one, D for drug. So Part D is prescription drug coverage. You can't forget that one. And then Part C are Medicare Advantage plans. And those are the kind of plans that HMSA offers with our Akamai Advantage plans. A Part C plan will always bundle A and B coverage. So you'll always have A and B covered under Part C. And usually will cover Part D prescription drug coverage. And all of our plans, our Akamai Advantage plans, include and bundle in prescription drug coverage and extra benefits that fill in the pukas of original Medicare, because original Medicare has pukas, hearing, dental, eyeglasses and contacts, travel. Those are the kinds of things not covered under original Medicare. So the Medicare Part C plan, like Akamai Advantage at HMSA, is what helps to bundle all that together and give you those extra benefits to fill in the pukas. So simply put, that's the parts and what they cover. And for those of you who are wondering how to be eligible for Medicaid, Medicaid is different from Medicare. So remember, Medicare is 65 or better. And Medicaid, you actually have to meet a certain income requirement or be chronically disabled. And again, this is administered by the state, and it's under HMSA Quest integration, also known as Quest, also known as Medicaid. So it can be confusing because it's the same program with different names. But Medicaid for Hawaii is Quest integration with HMSA.
Tati, how often or throughout a calendar year does open enrollment happen for Medicare?
Yeah, good question, because lots of things change with Medicare every year. One thing that never changes is the annual enrollment period, and that's from October 15th to December 7th of every year. And this is really the time that Medicare really expects their beneficiaries take a careful look at what you have in place and make sure you have the right plan come January. So it's an open period. You can change your mind as many times as you like during that time. As long as you have that last application by December 7th, that will start on January 1st.
With Medicare, when a person signs up for Medicare, what are their plan options?
Okay, so first, when you turn 65, there is an initial enrollment period. So you have about a 7-month window within which you can enroll in Medicare when you first become eligible. Once you enroll in Medicare, you have original Medicare, but there are several options for you. You may be able to keep your original Medicare as is, add in a Part D prescription drug plan because you have to have that piece of it as well, and maybe consider a Medicare supplement plan that can fill in the out-of-pocket costs or coinsurance, which is usually 20%. However, another choice, another option that we have at HMSA are our Medicare Advantage plans. And like I said, those are the plans that will bundle it all together, A and B, prescription drug coverage, and the extra benefits. So it's all bundled together rather than trying to piece things together and looking for things separately.
When someone is eligible and they sign up, how can they get more information for themselves? Yeah, that's the thinking, right? That italicized. I don't need this right now. There's so many questions that I have, and it doesn't apply to me yet. How can people?
How do you find the right plan?
Yeah,
Yeah, that's true. Yeah, so at HMSA, of course, you can always contact us. We can tell you what we have as far as our options that are available. We have plans that start at $0 monthly premium for those on a budget. If you know you're going to use the services, you might want to get a plan with a premium that offers a lower out-of-pocket cost when you go to get your services. Or, as we mentioned previously, we have Medicaid. We have a special plan called Dual Care that combines the benefits of Medicare and Medicaid in a model of care where it's very low cost, no monthly premium, and really no co-payments for covered services by both of those sides. So you want to talk to HMSA at hmsa.com/dualcare or hmsa.com/Medicare and find out what your options are. Find out what your needs are. People have different budget, lifestyle, healthcare needs. So you really want to make sure you work with someone to choose the plan that's going to fit those needs.
I'm Kathy with a K with Hawaii Matters. We're talking story with Tati Guzman of HMSA, specifically Medicare. And you heard that there are phone numbers and websites, local operators here in the islands that you can talk story with. When are the times for that? Because I know people are like, oh, I would love to talk to somebody on island.
Yeah, so we have 2 local call centers.
Yes.
HMSA does, one in Honolulu, one in Kapolei. From 8 to 5, Monday through Friday, you're going to get a local call rep that will answer your questions. They're fully trained in all the Medicare products. They can enroll you over the phone, look up doctors for you, look at your drugs and prescriptions over the phone, and get you enrolled in the right plan, tell you what your options are. So that'd be from Monday through Friday from 8 to 5. After 5 o'clock, we do have a company that comes in and picks up the calls until 8 p.m. and on the weekends. But if you want to talk to someone local, Monday through Friday, 8 to 5.
Yeah, set your calendar, my friend. Again, can you just remind us when to enroll?
Yeah, so the annual enrollment period, it is a Medicare plan. So the annual enrollment period still stands. So that's October 15th to December 7th of every single year. You can change your mind, change plans, choose a plan, that's the time for you. And with the dual care plan, it's what we call a dual eligible special needs plan. And it's a type of Medicare plan that combines and coordinates the benefits of both Medicare and Medicaid. So if you have Medicaid with HMSA, you can enroll in the dual care plan when you're eligible for Medicare. We will coordinate those services, coordinate the claims. There are several really nice benefits that come with this plan besides actually the coordination of the care. We've got $133 a month shopping allowance.
Yes.
And that's for not just well-being products, but also utilities and groceries. So we've added that for 2025.
Wow.
So now you can get groceries, you can pay your utility bill with that, and get health and wellness products. There's a fitness benefit, so free gym membership at all locations of 24-Hour Fitness and YMCA, YWCA. We've got glasses and contacts, something that's not covered under original Medicare, $300 a year for that. So we have dental also, lots of dental benefits.
That's huge.
At $0 copayment. So really nice extra benefits we've added for the dual care plan.
I had also read somewhere that there's a penalty if you don't enroll on time. What is that about? I just kind of glanced at it. Again, I'm not in the zone just yet. I should pay attention now. Taking notes, Tati. I'm taking notes.
Yeah, you have to. You have to remember it all. So when you become eligible for Medicare, you are expected to enroll in both A, B, and prescription drug coverage. And if you miss that, there is a penalty for the B and the D. There's actually two different penalties.
Okay.
The most important thing to remember about this penalty is that it's a lifetime penalty. Once it's assessed, it never goes away for as long as you have Medicare. So what you need to know to make sure you don't get the penalty is to enroll when you're eligible. So when you become eligible at 65, make sure you have your A and B in place and then get your prescription drug coverage. Now, the thing to remember, too, is that if you're working, you're not retired yet, you're 65, you're eligible, but if you're working and you're covered under you or your spouse's working health plan, you can defer your Part B. You don't have to enroll in Part B until you actually retire and lose that health care coverage. So that's a lot of people defer your Part B because there is a standard Part B premium that the government sets every month that you pay. In 2024, that's $174.70. So if you're not ready to pay that yet, you don't have to. If you're working and you're covered under your employer plan, you can defer it till you retire.
Is there anything within the HMSA folder or file will give you an email or text reminder?
The government will not send you a notice when you turn 65. They're not like that. But what we do at HMSA, if you're already one of our members and you have a plan with us and you're about to turn 65, we will let you know, hey, you're about to turn 65. There's some new options that you might want to consider. Give us a call, contact us, come into one of our neighborhood centers, and let us tell you what your options are as you turn 65.
I'm Kathy with a K. This is Hawaii Matters, talking story with Tati Guzman of HMSA. Medicare, importante, if you are a caregiver yourself, are approaching the window of 65. But right now, if you want to find out more information with HMSA, again, they have local operators. And what was the website again, Tati?
HMSA.com/Medicare. And we're actually doing workshops every month as well. Not even just during this annual enrollment period, but throughout the year. For people that are retiring, we have a monthly free Medicare workshop. It's usually me or my cohort, Tina, and one of us will go walk you through a workshop. What's Medicare? What are the basics? What are your options? What do we have to offer you through Akamai Advantage? So there's that opportunity as well. And, of course, our neighborhood centers, again, it's nice to be able to come in and talk to someone locally, face-to-face, that can answer your questions. We have centers in Honolulu, Pearl City, Lihue, Kahului, and Hilo. So wherever you are, you can come and see us or give us a call and talk to a local rep.
Can you talk about some of the other benefits of being an HMSA Medicare Advantage member?
Yeah, so if you're already an HMSA member and you don't have to be 65 for these benefits, we have a lot of extras that people aren't aware of. So one of the things is called HMSA 365. If you go to HMSA.com and search for 365, we actually have agreements with several health and wellness vendors across the state that will give you a discount at the point of sale just by showing your blue and white HMSA card. So go online, find out by island who those vendors are, go there with your blue and white card, and you can get a discount right at the point of sale. We do health education workshops. These are really fun, free, not just to members, but the entire community, usually held at our neighborhood centers. We have an educator that's been doing it for 25 years, and he's really fun. So they're fun, they're interesting. You usually get free stuff, and you learn a lot about nutrition, heart health, kidney health, osteoporosis, balance, all kinds of things like that. So we've got that going on. We have my account. We have behavioral health program in case you need someone to talk to, some counseling, and we have healthy aging coaching. So there's lots of things that we offer that people aren't aware of. Go on hmsa.com and find out what those are. If you go to hmsa.com/wellbeing, you find a list of all the different things that we can offer you.
It's wonderful that there are free, accessible, open to the public workshops available. Thank you, HMSA. Talking story with Tati Guzman of HMSA Medicare. Now, it's for those turning 65 and better, and I'm almost in that threshold. Let's not get specific. Really amazing information, and get to hmsa.com/dual care about the Medicare and dual care plans. Toll-free number 1-800-693-4672. And I like about the in-person option. Tati, was there anything you want to remind people ahead of the December 7th deadline to sign up?
Yeah, don't wait till the last minute. Make sure you do your shopping. Make a very careful choice based on what your healthcare needs are and what your budget looks like. We've got some options for you. Just don't wait too late. You have until December 7th. Make sure you get that enrollment in, or if you're going to be changing plan. Also very important, if you're already an HMSA Akamai Advantage member, we have already sent you a list of what's changing for next year, for 2025. And if you're happy with those changes, you don't have to take any action. You'll automatically be re-enrolled starting January 1st. So for those of you who are already our members, you don't have to take any action at all. And we've got great new benefits starting in 2025. In fact, one of the brand new things we added for our Akamai Advantage plans is hearing. We hadn't had it in the past. So starting in 2025, we have no co-payment for an annual hearing exam and an allowance for hearing aids. So we're very happy to be able to add that finally to our plans in 2025.
And if you're saying, huh? Then, you know,
probably need to look into it. Yeah.
Tati Guzman of HMSA, thank you for joining us today for Hawaii Matters. To share or replay this episode, you can look for Hawaii Matters where you stream podcasts. For Pacific Media Group and Hawaii Matters, my name's Kathy with a K. Mahalo.